Hey guys, quick video on equalization for divers. We've got two main methods here. One is VALSALVA, the other one is Frenzel. The difference is that VALSALVA is done with the mouth and nose both closed, whereas Frenzel can be done with the mouth open, but you're closing the soft palate. Second one is very, very useful. I think if I remember correctly, it was developed during World War II for bomber pilots. But for the purpose of this video, we're going to stick to the first one because that's a good one to start with. Okay, so what we're trying to do is we're trying to move the position of our eardrums. Okay, so if this is our head here, this is our ear here, nice big ear. Then what happens with our eardrum? Our eardrum is normally fairly neutral, like that. As we start going down, what happens to the eardrum? It starts bending inwards, which is uncomfortable. So what do? We try and pop it out. Okay, how does that mechanism work? Well, the eardrum is connected to the eustachian tube. And the eustachian tube, per default, is closed. It's got a circular muscle around it. So what happens is when you push your fingers on your nose and you blow out, you are forcing air from your throat through that eustachian tube, forcing the eardrum back into that neutral or even positive position. Sounds pretty straightforward, right? Well, why don't we have to do anything on the way up? Well, on the way up, the eardrum does the opposite. It starts bulging out, meaning that there is a positive pressure in here. Now, all that requires to open the eustachian tube is a positive pressure. So let me go through that again. So it's very, very clear for you guys. And let's get rid of the head as well. So on the way down, my eardrum is neutral, then becomes a little bit negative and a lot negative. And the longer you wait, the harder it becomes to equalize. So what you do is as you go down a little bit, I'll get rid of this one. You got two options. You either wait until you feel a little bit of pressure here and you create a positive pressure through the mouth and the throat, pushing that eardrum back into the neutral position or preferably into the positive position. Because if it's in the positive position, then what you can do is when you go down a bit further, now you're back to neutral. You make it positive again. You go down further, now you're back to neutral. You make it positive again. So you can almost avoid that negative position. The negative position is much harder to equalize than it is from neutral to positive. So the trick here is to equalize often and early, smaller little amounts. Now, if you find that you are naturally not very good at this equalization at all, it could be that you're just not used to it and that you are not used to opening and closing eustachian tubes. If that's the case, just practice, even on the surface. Can I make them pop? If you are struggling to equalize because of congestion, then cut things like dairy out, cut things like alcohol out, cut things like cigarettes out, and see if you can try and restore that eustachian tube health a little bit, at least for a little while, and then maybe very carefully introduce it back into it again. So again, on the way up, how does this work? So we're diving around, let's say 30 meters, our eardrum is neutral, and we decide to go up a little bit. So what happens? The pressure increases, therefore our eardrum becomes slightly bulged out like that. Now, why is this not a problem? Because we said the eustachian tube opens when there is a positive pressure. So there's now a positive pressure in our inner ear. It means that we just swallow and the air or nitrox or whatever you're breathing will go back into the throat, meaning that the eardrum now becomes neutral again. Again, we go up a little bit. What happens? It becomes positive pressure, meaning that it will go through the eustachian tube. Pretty straightforward. Now, some of you might have read the concept of a reverse block. A reverse block is exactly this. You're struggling a little bit with equalization, you manage to get down, but you have a cold or something like that, and the reason why your eustachian tube is blocked is because of that cold, it's because of that congestion, right? And this is mostly why you are being told not to use decongestants, because they wear off. So your eustachian tube is looking like this. It's got all these blobs on it of mucus and snot and crap, right? So imagine on your way down, perhaps the decongestants are working, or perhaps you just managed to go push past it. Yeah, so you're down at the bottom. Now you want to go up. Now you got this positive pressure in your eardrum, but it won't go back because you had to force yourself. Oops, that is a reverse block. You're going to struggle to come up because the air won't go back through the eustachian tube into your throat. Okay, what can you do to resolve this? Well, if you feel very confident, you could lift your mask up a little bit if you're in salt water, and just try and snort a little bit and see if you can clear that and blow it all back out again. If that doesn't work, what you got to do is just come up a tiny bit and then stay there. Come up a tiny bit and then stay there. Okay. Equally, if you're going down, and this is one thing we've seen hundreds of times. If you're going down, you're on holiday, you don't want to miss the dive, but you're struggling, and it's hurting, and all of a sudden there's this wave of release. And then at the end of the dive, you feel this water in your ear. It is not water. Okay, so what's happening here is your eardrum is very, very negative. The eustachian tube is blocked with whatever. More negative, more negative, more negative. What happens is now there is a large vacuum inside here, and you'll have capillary blood vessels bursting, filling that eardrum with a lovely amount of blood and pus and what have you. And that is the water in your ear you're feeling. It's not water. Okay. The issue with this is now that you're going to get an inner ear infection because this stuff is not very good. It's sitting there in your ear. It's going to make the ear infected. And now your holiday is even worse. All right, there's also a chance that you're damaging some of this, you're creating scar tissue, and the equalization is now going to become harder. So if you got a bad cold, just don't dive. The sea will still be there tomorrow. Okay? I hope this has made sense, that you've got a little bit more understanding on equalization, how the eardrum works, how the eustachian tubes work, the concept of a reverse block. So if you're struggling a little bit with equalization, practice on land. Get used to opening and closing that eustachian tube. Equalize early and often. So don't wait until the eardrum hits a negative. Get it from neutral to positive, and then go down and continue doing that. Okay? You guys got any questions or anything you want to add to it, or perhaps you want to see a video about something else, just pop us a quick message or write down in the comments, and we'll do our best to record it for you. Good luck. Hey, if you like this video, click up here to subscribe, and click up there to see more how-to videos.